quality at a lower price. That's what economics seeks, quality at a lower price. Now, one way that you can get business without providing quality at a lower price is to monetarily incentivize the other party to engage with you, all right? We see that a couple ways. One way that we saw for a long time was, and I think this is a really good example that you could then extrapolate to other industries, is they were doing this. Laboratories that wanted to do drug testing, urine testing, and all that kind of stuff, they would say to a doctor's office, we will provide you with a free phlebotomist, but you got to promise that you only send it to our lab. The lab companies are all trying to say, oh, we don't get what's the problem. The doctor isn't having to pay for a phlebotomist, right? And even try to maybe even make the cost, well, it reduced the doctor's cost, and all that kind of stuff. Here's the problem though. The problem though is that inextricably linked that doctor's practice to that laboratory. So that laboratory no longer needed to engage in cost control measures because they knew that that doctor was always going to go to them regardless of the quality, regardless of the price, because they were giving them a free phlebotomist. Now, we've had cases where hospitals have said to doctors, we will give you free space, but you've got to promise that you send all of your rehab, all of your testing, all of your radiology has got to come to us. What they are doing is giving the practice something of value, not out of the goodness of their heart, but to incentivize the doctor to look past quality and price and give it to them just because, they've essentially gotten a kickback. Let's be clear about something on a kickback. It is not a defense. I mean, it's a defense, it just doesn't work. To say, oh, well, we were just giving them, whether it was a phlebotomist or a receptionist, we didn't require them to send their services to us. We just thought it might be a good incentivization, right? You can't give the practice anything of value, all right? Because we all understand human nature. It doesn't have to be a absolute. In other words, we're giving you a phlebotomist and you've got to give us all your work, right? If you're giving them anything of value, that is a potential kickback case. One of the reasons that anti-kickback cases can be so lucrative, all right, is because the damages can be so high. The damages in a kickback case can be greater than just the value of the service that was provided. So let's take a situation where a doctor's practice has received something of value, all right? And then they sent business to another entity, and then that was billed. When that practice bills for that service, when they send the bill to Medicare and Medicaid, they have to sign something. And one of the things it says was, I didn't accept anything of value. So let's say a phlebotomist is 80 grand a year, all right? The damages is more than just the $80,000 a year that the doctor or the practice accepted. The damages is all of the work that they sent to that lab is fraud because they certified that they didn't accept anything of value when in fact they did. And so the billing that was done to Medicare and Medicaid becomes the fraud because it becomes a certification case because you've certified that you didn't accept anything of value in deciding where to send that work when in fact you did. If you feel like it's just not right, come talk to us.